Department of Health and Family Welfare, Government of Kerala. Standard Operating Procedure for Health and COVID-19 First Line Treatment Center, June 2020. Part 5. To provide the necessary psychosocial and mental support, the COVID-19 First Line Treatment Center shall liaison with the district mental health team. Staff should counsel and provide psychosocial support to the patients. Necessary provisions may be arranged to provide consultation services to those patients who show psychological distress. In COVID-19 First Line Treatment Center, Nodal Officer is the overall charge of imparting capacity building, with the support of trained nursing staff, Health Inspector, Public Health Nurse, volunteers. Any volunteer recruited should be screened clinically as well as for any history of travel or contact history, and shall be posted in low-risk areas after adequate training. Capacity building can be classified into 3. 1 is the general awareness training regarding COVID-19. The general awareness training is given to all staff including the security staff, housekeeping staff, dietary staff, volunteers. Next type of training is the general CFLTC management training. This training is given to the key medical staff, local self-government staff, and representative, and the volunteers involved in the activities of the CFLTC. Next type of training is skill training. Skill training is given for medical officers, staff nurses, pharmacist and lab technician. For medical officers, training is given regarding swab collection, clinical case management, infection control measures including the rational use of personal protective equipment. For staff nurses, training is given regarding triaging of patients, observation and inpatient management, infection control including the rational usage of personal protective equipment, swab collection, etc. For lab technician and pharmacist, training is given regarding infection control including the rational usage of personal protective equipment, laboratory and pharmacy management, swab collection or other sample collection, storage, and transportation.
General patient management issue. NSAID use. Acetaminophen is the preferred antipyretic agent, if possible. If other NSAIDs are needed, it's better to use the lowest effective dose. There are only minimal data regarding the risk of NSAIDs in the setting of COVID-19. Nebulized medications. Inhaled medications should be administered by metered dose inhalers, whenever possible, rather than through nebulizer to avoid the risk of aerosolization of SARS-CoV-2. Glucocorticoid use. WHO recommends that systemic glucocorticoids have no role in the management of COVID-19 patients unless there are other indications, example, COPD and critically ill patients. Managing chronic conditions. ACEI or ARBs. Patients receiving ACE inhibitors or ARBs should continue treatment with these agents if there is no other reason for discontinuation, example, hypotension, acute kidney injury. The speculation that the patients receiving these agents may be at high risk for adverse outcomes has not been supported by findings from observational studies. Conversely, ARBs, which has been proposed to have potential protective effects, have no evidence to support the hypothesis. Use of statins. Continue statins in hospitalized patients with COVID-19 who are taking them. Although clinicians may be concerned about hepatotoxicity from statins, particularly since transaminase elevations are common in COVID-19, most evidence indicates that liver injury from statins is uncommon. Antibiotics. Empirical treatment with antibiotics for bacterial superinfection pneumonia is reasonable in patients with documented COVID-19, if there is clinical suspicion for it. Most probably such patients will be shifted to dedicated COVID treatment center rather than keeping at the CFLTC. Prevention of thromboembolism. Non-pharmacological intervention for prevention of thromboembolism among hospitalized patients should be considered in patient care. Registers and reports. Registers should be kept in the triage area, consultation room, observation, IP wards, pharmacy and for lab services. Daily reporting may be done as per existing guidelines. Attendance registers of the healthcare staff to be maintained properly. All registers should be in the format of existing government system. Refer annexure for the list of registers to be kept in CFLTC. Committees. The various committees are formed to ensure the smooth functioning of the FLTC as follows. In CFLTC Management Committee, Superintendent or Block MO act as the chairperson and LSGD representative act as co-chairperson. In Institutional Medical Board, Superintendent or Block MO act as the chairperson and nodal officer should act as the co-chairperson. For CFLTC Infection Control Committee, nodal officer is the chairperson and nursing superintendent or officer or head nurse should act as the co-chairperson. For Logistics Committee, superintendent or Block MO or nodal officer should act as the chairperson and a pharmacy storekeeper should act as a co-chairperson. For Human Resource Committee, superintendent or Block MO and nodal officer should act as chairperson and co-chairperson. For Food Committee, superintendent or Block MO, nodal officer and head clerk act as the chairperson and co-chairperson. For Finance Committee, superintendent or Block MO and lay secretary should act as chairperson and co-chairperson. For Training Committee, superintendent or Block MO, nodal officer and nursing superintendent or officer or head nurse should act as chairperson and co-chairperson. Daily review meeting. Daily review meetings should be conducted by the superintendent or nodal officer. Number of patients seeking help at the help desk. Number of patients admitted, sent on quarantine. Number of samples sent, result received, positive, negative and pending results. Bed or dormitory occupancy. Number of patients discharged or referred. Logistics, transportation, human resources, complaints or suggestions, liaison with COVID hospital, other relevant matters. Logistics. Sufficient supply of medicine, equipment and other items should be ensured. Logistics to be reviewed daily and appropriate actions to be taken. Housekeeping and waste management. Proper environmental hygiene and housekeeping to be observed in the facility. Waste bins are kept in each isolation rooms and dormitory. Biomedical waste should be managed as per biomedical waste management rules. Image facility may be used accordingly. Refer Annexure 2. Thank you patient listening.